Good morning, East Africa. I hope that you're well this morning and you're getting ready for the day. This is your world, and my name is Winnie Lubembe. Now, about 2 years ago, news emerged of a new variant of the coronavirus that causes COVID-19. And since then, other variants have been identified while others are still being investigated. The new variants raise questions like, are people more at risk of getting sicker? And will COVID-19 vaccines still work? Well, are there new or different things that you should do in order to stay safe? Well, we'll be answering all these questions plus much, much more right here on today's show. But first things first, the day's highlights. Security officers from different disciplines to be involved in ensuring peace during elections. The family of Esther Wambui, who was killed and stashed in a suitcase, is desperate for closure. And Burkina Faso President Roch Kabore detained at a military camp by rebel soldiers. And families want DNA tests on unclaimed bodies from River Yala. And as mentioned earlier, today it's all about COVID-19 and what you need to know as far as vaccines and boosters and booster shots is concerned. So the question that we're asking you today is, have you been fully vaccinated? And if not, tell us why. Again, have you been fully vaccinated? If not, tell us why. And start tweeting at NTV Kenya at Lubembe_Winnie, and we'll be sampling your feedback during the show. But alternatively, you can also give us a call. The numbers will be down on your screen in just a moment. But before we take a look at the stories, how about we take a look at the COVID-19 numbers? Like we keep saying, we're still dealing with the pandemic. So let's take a look at the numbers, how they are looking as at now. And we'll begin with the global numbers. And up until now, 354,904,903. This is the total number of confirmed cases across the globe. And then 281,820,521. This is the total number of people who have recovered from COVID-19. But unfortunately, 5,622,314 people have lost their lives to COVID-19. And remember, this is across the globe. But coming back to the country now, according to the statistics by the Health Ministry, 320,399. This is the total number of confirmed cases in the country as far as COVID-19 is concerned. 291,917. This is the total number of recoveries reported as of now, and 5,558. This is the total number of people who have lost their lives to COVID-19. Again, a gentle reminder that the pandemic is still here with us, so it is important that you keep yourself and the people around you safe by observing all the protocols that have been laid out by the Ministry of Health and the WHO. But of course, that discussion on COVID-19 and all about mutations is coming up in just a moment. But for now, Interior Cabinet Secretary, that is Dr. Fred Matiang'i, has said that security agents have identified, or initiated rather, a series of meetings to discuss the situation of the country's security. This is ahead of the general election scheduled for August 9th, 2022. Matiang'i, who met with officials from the National Police Service, the National Intelligence Service, the NCIC, and the DPP's office, says that an increased presence of officers from various disciplines will be needed as they seek to curb political utterances that may affect their security situation in the run-up to the election. Leila Mohammed reports.
The political field has seen a surge in activity in recent months, and as politicians continue with their spirited campaigns to woo voters across the country, security agencies say intelligence charter has compelled them to take significant steps to avoid the violence.
We will have more of our officers, whether they are from NCIC or from the DCI, embedded in some of this political activity, so that we not only detect crime when it's committed, but we are also able to document the evidence that we need to support prosecution.
According to Matiang'i, officers have probed 4 incidents involving political conflict since December 2021, with one before the court.
The behavior of some of our political leaders. One, the endemic false promising that is happening around the country, the incredible amount of bribing that is going on, bribing groups of people, ferrying young groups of people and bribing them in the process, and sometimes mismanaging those organizations and causing conflicts amongst groups of people. That is the phenomenon we are seeing around here.
The CS says that the Inspector General of Police is investigating complaints made by the UDA campaign team to the president recently, but he further slammed the country's second-in-command for crying foul over what he calls unfounded claims.
Some of those who are complaining are guarded by police, some of them from the highest levels of our deployment. In any of those rallies you go, where the writers of those letters come from, there is not less than 50 police officers, not guarding or 90, focused on the individual leaders. So how would then police plan to go and enable violence against the police?
The KICD meeting is the first monthly such security gathering where a multi-sector team will examine the situation of the country's security as the country prepares for heavy political engagements over the next 7 months. Matiang'i has warned politicians to cease attacking public officials in the course of their jobs and urged all officers to carry out their duties within the limits of the law to protect public safety, particularly where large crowds gather to hear politicians sell their agenda. Leila Mohammed, NTV.
Well, thanks, Leila. And the family of the late Esther Wambui, an 18-year-old lady whose body was found stashed inside a suitcase with a revenge note abandoned outside the General Service Unit's Reke training grounds in Ruiru, is calling for speedy investigations into the Inyas killing of their daughter. Postmortem results conducted on Friday indicated that the late Wambui died as a result of strangulation, with police extending investigations 2 years back when the deceased reportedly left her family in Nakuru after dropping out from school, only to be reunited with her beloved ones dead. NTV's Seth Olale with the latest update on the murder that continues to shock the nation.
At Miti Mingi area in Nakuru County, the distraught family of the late Esther Wambui, whom they reportedly last saw 2 years ago when she dropped out of school, are still struggling to come to terms with the chilling murder of their daughter that left the nation in shock. Esther Wambui, an 18-year-old from to drop out, was tortured and murdered and her body discovered stashed in a suitcase abandoned outside the GSU Reke training grounds in Ruiru Monday afternoon, with writings inscribed on her palm, chest and thighs that read, "Bwana ya mtu ni sumu." To paraphrase it, someone's husband is a no-go zone. But according to detectives, the writings by the killers may be a ploy by the killers to mislead the investigators.
Lakini kwa sababu ya imetendeka, mimi nitatosheka tu. Nitasema hiyo ni ya Mungu, na Mungu naye halali. Lazima atafanya wale walifanya hiyo kitendo waumie.
Tumesitikika na hizo kifo. Hukuwa na habari, kwanza mimi nimejua leo, nikakuja kushughulikia nijue ni nini iliendelea. Hata kuolewa kwake sikujua, lakini nilikuja kujua aliolewa juzi, kakataa shule. Ni shule alikuwa anasoma akaacha. Akaolewa na huyo kijana. Hata nilijua juzi tu ati ameolewa, ameenda huko Juja.
Nilikuwa nasikia maneno, hata ukimpea kazi, hata afadhali ifanye haraka na amalize. Na apumzike.
Na ungemsomesha tu ni ile yeye mwenyewe aliacha tu.
Nini ningemsomesha? Niko na kijana nimesomesha, amefika form amemaliza. Na sasa hata yeye ningemsomesha, hata ingawa huku simeona ni mashambani kabisa. Kuna shida kidogo ya pesa, lakini huwa tunang'ang'ana, tuna Mungu anatupea.
Police are treating 23-year-old Simon Ngigi, who has been her supposed husband for 7 months, as a person of interest and main suspect in the gruesome murder. Ngigi has told the police that he last escorted his wife a few kilometers near her workplace at around 5:30 a.m. Monday the same day she went missing, only for her mutilated body to be found by curious pedestrians hours later. A team of homicide detectives led by Ruiru DCIO, Justice Ombati, and drawn from both Ruiru and DCI headquarters along Kiambu Road, are however questioning Wambui's husband for not reporting to the police after his wife failed to return home on the fateful Monday evening. Additionally, Ngigi reportedly failed to pick his wife from work as the norm that evening and didn't call his wife's colleague or close friends to inquire why she did not return home. The Ruiru DCIO, Justice Ombati, has confirmed to NTV that his team earlier today collected Ngigi's mobile phone data and GPRS from DCI headquarters to establish who Ngigi was in communication with amid unconfirmed reports from a section of Esther's colleagues that her husband was insecure, claims denied by Ngigi. Post-mortem results conducted on the late Wamboi on Friday at City Mortuary in Nairobi indicated that the deceased died as a result of strangulation. The late Wamboi was an attendant at a fast food joint within Total petrol station along Thika Road bypass area. Wamboi had been tied with a nylon paper around her neck, tortured with a deep cut on her left breast, and she appeared to have been raped. Seth Olale, NTV.
Quite unfortunate. And elsewhere, several families that turned up on Monday at the Yala Sub-County Hospital mortuary to search for the bodies of their loved ones now want the government to step in and conduct DNA tests on the unclaimed bodies for easy identification. The anxious families told Oko Kusa that due to the deteriorating status of the bodies, only DNA samples could be used to identify them. Here's the full report.
They arrived with high hopes of putting an end to months and years of agony, but their hopes died on the steps of the mortuary. Reason?
Sijui ni ile mili iko hapo sasa, siwezi kuitambua kwa vile imeharibika sana, yenyewe ni vingumu.
Na kweli tumeangalia pale na sijui niseme hayuko ama yuko, kwa sababu vile zimewekwa hauwezi kujua, lakini tumeangalia.
Tumekuja hapa tumeangalia kwa mortuary. Ile iko karibu yote imekawika, iwezi kuwa identified and kufanyiwa DNA.
Since the news of the floating bodies on the Yala River broke a week ago, only 2 families have been able to identify their kin positively.
Wale marafiki alikuwa nao wawili tuliwapata hapa mortuary, lakini hiyo wangu hajapatikana.
Nancy and the other moms who were able to gain access to the mortuary had to endure terrible scenes of stacks of badly decomposed bodies, some with missing private parts.
Na hata tunasikia kuna zingine bado ziko kwa mto. Sasa hatujui atapatikana ama hatapatikana. Tumetafuta.
Although the government says it has dispatched a special team of forensics to Yala to investigate the mystery behind the floating bodies, Nancy and the rest of the families looking for the remains of their loved ones to bury are more concerned with which of the 23 bodies fished out of the Yala River belongs to their relatives.
Sasa tulikuwa tunaomba serikali anisaidie, hata kama wanaweza kupata mwili ya mtoto yangu, nichukue ndiende nizike.
Interior Cabinet Secretary Fred Matiang'i has stated that he will not comment on the matter until the investigators have completed their work.
I would not like to speculate on that matter, and I would like to request colleagues, whether it's from you good people from the press and our other colleagues, let's not speculate on that matter.
Back at the Yala River, the body of a man seen by NTV last week on Thursday, trapped between rocks, continued to float in the waters, attracting curious onlookers. Ouko Kusa, NTV.
And across the country, Burkina Faso President Roch Kabore has been detained at a military camp by rebel soldiers. This follows heavy gunfire around his residence in the city of Ouagadougou on Sunday night. Due to the ongoing unrest, the government imposed a dusk-to-dawn curfew and closed several schools. On Sunday, the government denied rumors of a coup were underway. A steady gunfire broke out for hours from several military bases, with rebel soldiers demanding for more support for their fight against Islamists. extremists. Now, frustration has grown in the West African country in recent months due to the frequent killing of civilians and soldiers by the militants, some of whom have links to the Islamic State and Al-Qaeda. And a 10-year-old rhino that had its horn brutally hacked off returns to the wild after 30 operations over 6 years to repair the gash in its face. Now, his rescuers named the bull Sehawakule or Sehawikele, right? Meaning God have mercy on us, called Seha for short. He was found by police stumbling near a fence in a reserve, so disfigured that he could barely hear or eat.
I must say he's actually healed exceptionally well. And I think this is the next chapter where we're going to rewild him again in a 2,000-hectare camp, where we've put 2 females of breeding age with him in that camp, so that he can make them pregnant. Because at the end of the day, that's actually why we are saving these animals. It's not for them to stand in a zoo or anywhere else and, you know, for people to look at, but for them to contribute to the population again.
I suppose with his horrendous injury where he's got this open sinus cavity, I think the biggest risk for him is getting fly infestation in his sinuses. No rhino translocation is without risk. I think most of the others we've mitigated. But that will remain a risk for us. Fortunately, he's habituated and accustomed to humans, and he takes feed readily, so we will have the opportunity to treat that if necessary.
Well, that is quite sad to see, but let's focus on the conversation of the day today, and it's all about COVID-19, and we're just trying to unpack the mystery behind it, because again, recent days we've seen a lot of mutations, and that is reports, you know, from different health bodies talking about the different mutations and also the vaccines. And of course, the question that so many people have is that, are these vaccines that we have right now across the globe, are they effective to actually fight the virus? Well, we are joined by an able panel. So with me right here in Studio A is Professor Julius Oyugi, who is a virologist. Good morning, and thank you very much.
Thank you for having me in the studio today.
Welcome. And then we also have Studio B. We have Dr. Willis Akwale, who's the Chair, National COVID-19 Vaccines Task Force. Good morning, Dr. Thank you very much for your time today.
Good morning.
All right, and also we have Eunice Omola, who is our very own science and health journalist right here at NTV. Good morning, Eunice.
Good morning, Winnie.
All right, and also on Zoom, we also have journalists across the East African region. And right now we have Kelvin Matandiko, who's a journalist at The Citizen, and Mwananchi. Habari asubuhi, Kevin.
Habari za asubuhi.
Njema sana, asante. And then we also have Norbert Atakunda, who's a health journalist that is NMG in Uganda. Good morning, Norbert. How are you doing?
Good morning.
All right. And of course, we also have Marceline Odhiambo, who is a media graduate, but also has, you know, felt some type of way as far as vaccines is concerned. And of course, we'll be speaking with her. So Marceline, good morning. Thank you very much for accepting to speak with us this morning.
Good morning.
All right. Now, let's just begin with the numbers across the board before we start with the conversation on mutations and what do they mean and how do, you know, viruses get to mutate. Let's talk to journalists, and we'll start with you, Kelvin Matandiko, who's a journalist at The Citizen, and Mwananchi from Tanzania. Kelvin, tuombe tueleze hali vipi nchini Tanzania?
Hali ya maambukizi au unataka kujua hali
hali ya maambukizi nchini Tanzania.
Okay, sawa. Kwa hali ya maambukizi kwa nchini Tanzania katika na ningependa kuzungumzia takwimu ambazo zimetolewa na Wizara ya Afya kwa kipindi cha wiki 2 zilizopita, kwa sababu hivi tunavyozungumza kesho waziri wa afya atatoa takwimu na updates ya hali ya mwenendo wa COVID hapa Tanzania. Kwa hivyo nitazungumzia takwimu ambazo kidogo ni za wiki mbili zilizopita. Ukiangalia hali ya maambukizi kwa Tanzania kwa sasa hivi, kwa takwimu za wizara zinaonyesha kwamba katika kipindi cha wiki moja kuanzia tarehe 8 mpaka tarehe 14 Januari this year, kuna Watanzania 8 wamefariki dunia kwa sababu ya COVID, na wamefariki dunia kutokana na idadi ya wagonjwa ambao wamepatikana 998 ambao wamepatikana katika kipindi hicho cha wiki moja. Sasa kumekuwa na ongezeko la 20% katika kipindi cha Januari. Ni ongezeko la 20% la wagonjwa ambao wamepatikana wamegundulika na COVID-19 kwa hapa Tanzania. Kwa ujumla sasa ukiangalia hali ya maambukizi kwa Tanzania tangu COVID ilivyoingia katika ile wimbi la kwanza la COVID mpaka sasa hivi tumekuwa na maambukizi ya Watanzania 32,393. Kwa hivyo ukifanya wastani unaweza kupata Watanzania wawili waliambukizwa na COVID kila baada ya saa moja.
Okay. Kelvin, wacha tuzungumze naye Norbert kutoka Uganda ili tujue hali ya maambukizi ya corona iko vipi nchini Uganda, and then tutarejea kwako. So Norbert, kindly just take us through very briefly in terms of the statistics, the numbers of infections and those ones who've lost their lives to COVID-19.
Thank you very much. As of 22nd of January, which is the latest data from the Ministry of Health, out of more than 2.3 million tests that were conducted since the pandemic started, the cumulative cases stand at 160,572 cases. When you look at the recoveries, there are more than 99,000, and the death about 3,483. Now the positivity rate, if you're going to look at where we stood at the end of last year, December, there's a point where we registered 1,000 cases and the positivity rate stood at 20 point something. But the positivity rate has started to reduce. We are seeing the positivity rate from the 20 point something to 4 point something. We're now at 3.5. And the admissions are also reducing in terms of the health facility. So in terms of when you look at the vaccination rates, we are 12.5 million more than, obviously. Those who have taken the first dose, 10.6, and the second dose, 1.9. I don't want to, when you look at the terms of the booster dose, the uptake is still low. But when over the weekend, I was having an interaction with some of the hospital director at a referral hospital and was telling me averagely in a week, last week they had about 6 COVID patients, but at the same time, people are still dying. So COVID-19 is still out there. Though we are seeing a reduction in the hospital admissions compared to what were at the beginning of January or by 31st December last year, COVID-19 is still out there. People are still dying, obviously.
All right. Yes, and of course, I like what you're saying. COVID-19 is still here with us, so let's just try as much as possible and be safe and take care of one another. But then again, let's come back to the country. Maslini, I'll come to you in just a moment. Let me just finish with the journalist in terms of the updates, and I'll come back home. And right now, Eunice Omolo is here with us in studio. And Eunice, you have been covering COVID-19 ever since, it was announced in the country, and that is in March of 2020, and monitoring how the numbers are as far as the positivity rate. One time we hear the positivity rate is very, very high, and then all of a sudden, a few months later, it has been fluctuating over time. But right now, right here, how are we doing?
Thank you, Winnie. It has been a journey, a long journey reporting COVID since 2019 December, when the first case was reported in Wuhan, China. And right before, going through the wave, going through the journey, we've been having fluctuation in terms of the positivity rates that we had. And in October, when the president, lifted some of the measures that were there. At this point, we are at 5%. We were below 5%. And this is the recommended positivity rate for a country in order for the government to ease some of the measures that are there. And I remember in October, when he announced that we're no longer going to have the curfew, and things were eased. And even earlier before that, we had even the Matatu's restriction being eased, so that at least we can have, the movement was like, we are moving on to our normal life, our normal world. But when we were about to get to, then Delta happened, then we had Omicron. So during Omicron, we've had, a spike in terms of the number of positive cases, people being confirmed positive for COVID. We even have more than 1,500 people who tested positive for COVID-19. And I remember we had, right before December, we had one of the highest positivity rates, hitting 30 plus, almost 40%. And we had these numbers, in their two-folds. We had these numbers in their three-folds. We were having these numbers doubling every single day. And there was even a debate. People were like, is the Ministry of Health pushing these numbers so that we can have more people vaccinated? And remember, Ministry of Health had a target of 10 million people vaccinated by the end of 2021. And well, we hit the target. We have 11 million people vaccinated. Then come January, after we hit the target, we are having a drop in terms of positivity rate. Like yesterday, we had like 2% positivity rate in the country. So yes, we have the mutating virus. We have the changes in terms of the variants that we are experiencing in the country, in the region, in the world. But then again, well, people have questions. I think the Minister of Health will help us understand why we have numbers dropping after we hit the 10 million mark.
Yeah, and of course we have some of the latest numbers, that Eunice has prepared for us as far as this, just to look at very briefly on how Kenya is doing. But Eunice will not touch on the boosters at the moment. So yeah, we'll just talk about the numbers that we are seeing on the screen.
Yes. So basically, this has been Kenyan journey in terms of vaccination. We all know that in total we've received over 24 million vaccines, either through donation and or acquired by the country. And remember, we have about 5 different vaccines that are administered in the country. So total vaccines that are administered are 11,553,637. Then we have 6.3 million people who've been partially vaccinated. Fully vaccinated people stand at 5 million. Quite low. And then people who've shown up for booster shots are 115,407. Yes.
Right. And of course, those numbers again, they are dispersed across different counties, but we'll look at them a little bit later as we continue with the discussion, Eunice. But right about now, you did so well because, like you said, people have questions. And it's very good that we have Dr. Akwale here in studio with us to help us with all these numbers. So Dr. Akwale, very, very briefly, taking a look at Tanzania, we also looked at Uganda, and right now, we actually just looked at the country as far as the numbers. So really, what do these numbers really mean?
Oh, okay. Thank you very much, Winnie, for that question. What I would actually start by saying is that let me clearly state that at the Ministry of Health, we've invested so much to ensure that the numbers we share are accurate, and we are consistently reporting. As you know, we are doing this on a daily basis, both for the COVID numbers and the vaccination numbers. So for any Kenyan to think numbers are cooked, I can tell you, trust the Ministry of Health numbers. There may be small issues here and there, but we strive to ensure that these are as accurate as they can be. And we are always improving this. In fact, especially for vaccination, we now want them to be real time. And at any one time, one would be checking and knowing where we are. Now, but let me then come to the issues of positivity. Yes, in December, the positivity rate was very high, driven by the Omicron variant, which, as we said, is highly transmissible. And we saw that very high rise up to 40%, as Eunice reported, and now that has come down. In terms of vaccination, it has been a journey. Last year, the biggest challenge we had was global supply. And therefore, our target was 10 million vaccine doses, because at that time, because of global supply constraints, we wanted as many Kenyans as possible to even be partially vaccinated. And that's why we chose 10 million. But from September, October, we started getting adequate doses, and you consistently saw this supply, us receiving these doses from global partners and from initiative by the African Union. I'm happy, especially by December when we did a campaign. The month of December alone, we administered 3 million vaccine doses. 3 million, and we were able to achieve our target. And it is also during that time, not only the issue of Omicron, but also waning, evidence of waning vaccine immunity, especially in the vulnerable population. We started the booster doses. As you can see now, over 115,000 booster doses have been issued. And it is important to interpret that the booster shot is administered 6 months after your second dose of the primary vaccine. So for us in Kenya now, we are vaccinating anybody who had got 2 doses by 30th June of last year. Our data shows that 370,000 people actually received that. So we are moving close to 50% of that. But I think it's important that now Kenyans know the booster doses are there, and our policy is that you can retain your primary series, meaning if you took AstraZeneca, you can take a 3rd dose of AstraZeneca. If you took Moderna, you can take a 3rd dose. But we can also get a messenger RNA, Pfizer or Moderna, mixed with the others. So I think we are moving well. There's been a slowness in the uptake during January, and we are trying to address this through a campaign that will be starting later this week.
All right. And of course, I'm curious because, like Eunice said, the number of people who have been fully vaccinated in the country is quite relatively low. And here we are administering booster shots. So again, what are we doing to ensure that these people who are partially vaccinated get to fully vaccinated? But then again, let's talk to Professor Julius Oyugi. I mean, all these numbers, you know, here and there in all these different countries. But so many people, and then we also hear a lot of the Delta, the Omicron. We have like Gamma, we have a lot of these strains you know, in the country. So right now, across the globe, someone might be curious to just understand how many strains of COVID-19 are there, and should we expect more?
Thank you very much. So number one, we need to understand that every time a virus gets into a human population, it gets in as one virus, and then over time it starts mutating. Mutation is for the survival of the virus, because the environment under which this virus is surviving in your body is also hostile to the virus. So this mutation leads to emergence of new variants, and these new variants, you know, many of them are actually produced, but only one become dominant. Like if we talk about Omicron, before Omicron there was Delta. So now we are not talking about Delta. So what has happened with Delta? It means that Omicron, when it came, it is now easily more transmissible than Delta, and it became dominant all of a sudden. And this is common with viruses. And so we have, I think we have about 6, 7 variants that are circulating now. But the most dominant now is the Omicron. There's also the one that you did mention, the Mu, which started from Colombia last year. Is in Europe. There are people who are still being infected by this variant. Yeah, so it's a normal thing for viruses to mutate and change and develop new variants for their own survival. And as if you look at what's happening now globally, the World Health Organization decided to classify them, these variants, as either variant of interest or variant of concern.
Of concern, yeah. And we'll be looking at these 2 terms and what exactly they mean, and why people need to know about these terms, first of all, and probably be cautious about. But let's finish up with the journalists, especially you know, in Tanzania and Uganda. And coming back to you, we'll start with you, Norbert, and of course I'll ask the same question to you, Kelvin, in terms of monitoring these numbers. And of course you have been reporting about these numbers over and over again, tracking as far as the positivity rate versus what the government is doing to just make sure that then the virus is contained as much as possible. What would you say? Let's begin with you, Norbert.
Definitely the message has stayed the same. As you're aware, yesterday the night the economy reopened. There are still a few restrictions probably on the border cyclists. So definitely leaving us to, according to the scientists, it could lead to an increase in cases or not. But the government, the message has stayed the same: vaccinate, go for vaccination. Because when you look at the hospital administrations, hospital admissions rather, according to the Ministry of Health, most of them are the elderly and those that are not vaccinated. So the message has stayed the same: go for vaccination, those who are eligible, and as well observe social distancing, mask up. But with the reopening of the economy, it's now, difficult, especially in bars. It's not, a lot of questions that have been arising from the public is that how will the SOPs be able to be observed when it comes to probably bars? But when you look at probably the public transport or the matatus, if you may say, people have tried. A good number of Ugandans have tried to put up to mark up, and but the washing of hands has a little bit, that the habit has reduced. It's not like as it used to be at the start of the pandemic or in the middle of the pandemic. So the SOPs are still observed, but some of them there has been a little bit of, people have relaxed a little bit, especially when it comes to the washing of hands. Because initially, before even you go to a taxi park, you would find at least a washing facility there. But now, and they would enforce that everyone who, before you enter any taxi, you have to at least sanitize or wash your hands. But now this is not, it's not being done as it was before. Masking, of course, a good number of Ugandans have tried, but definitely there will always be that number, a section of people who will not observe the SOPs. So we are also waiting and see how this will go on with the reopening of the economy. So yeah, we are waiting and see and observing the numbers, where there will be an increase or a reduction, because now at least you're facing a reduction in the
yeah. All right, thank you very much Norbert and Kevin. Uganda imefungua uchumi wao. Tanzania hali vipi? Na wewe kama mwanahabari ambaye umekuwa ukishughulikia masuala ya corona, unaweza sema aje, that like the country, unataka serikali ifanye nini ili kuhakikisha kuwa idadi ya corona inapungua nchini Tanzania kwa ufupi?
Ni kwamba ukiangalia kwa sasa hali ya namna ambavyo watu wa Tanzania wanachukua tahadhari bado imekuwa ni changamoto. Ukienda katika nyumba za ibada, watu hawachukui tahadhari kama ilivyokuwa mwanzoni. Ukienda katika vyombo vya usafiri wa umma kama daladala, kwa Tanzania tunaita daladala, kwa Kenya wanaita matatu, watu hawavai hizo maski na hawachukui hatua zozote. Lakini ukienda kwenye maeneo mengi ya masoko madogo madogo kwa hawa petty traders, pia na kwenyewe hawachukui tahadhari yoyote. Sasa pamoja na juhudi ambazo zimekuwa zikifanyika za serikali, kutolewa baadhi ya miongozo, lakini changamoto imekuwa ni hiyo, response ya jamii imekuwa ni ndogo sana. Kwa hivyo pengine labda serikali inapaswa sasa kuja na mbinu nyingine ambazo zingeweza kusaidia kupunguza maambukizi haya, ama kwa kushirikisha zaidi viongozi katika local government ili waweze kuongeza kasi ya kutoa elimu kwa wananchi, lakini pia kuongeza pia hata adhabu kidogo kwa watu ambao wanashindwa kutekeleza hayo masharti. Nimeona kwa mfano Kenya, mkazi wa Kenya wa Nairobi asipovaa maski anaweza kukamatwa na kutozwa labda penalty ya shilingi 2,000, lakini kwa Tanzania hiyo haipo. Kwa hivyo watu wanaona ni hali ya kawaida tu, na kama hawachukuliwi hatua basi wanaona kwamba hakuna haja ya kuchukua tahadhari yoyote. Kwa hivyo ni muhimu sana serikali ikaongeza mbinu ambazo inazitumia kwa sasa, kwa sababu ukiangalia trend ya maambukizi katika wimbi hili la 4 inaonekana kuongezeka, na hatari kubwa zaidi iko katika maeneo ya wageni wanaoingia pamoja na watu ambao kwa muda mrefu wamekuwa wakiathirika zaidi na gonjwa hili.
Asante sana, Kelvin, and thank you very much, Noban, as well. Kevin Matandiko, journalist at the Citizen and Mwananchi from Tanzania, and Nobat Atukunda, health journalist, that is NMG, from Uganda. Thank you very much to both of you for speaking to us this morning, just giving us an update on what's happening in your respective countries and what you expect to see the government to do to make sure that then, again, the cases of COVID-19 are contained in your country. So we have to release you now, but thank you very much for speaking with us this morning, and we hope that you continue doing the good job, and that is informing the people on what's happening as far as COVID-19 is concerned. So asanteni sana, Nobat and Kelvin. But Marceline, we're still with you, and of course we'll still continue with you, but I just want to talk to you very briefly as far as vaccine is concerned. I know we're talking about vaccinations. There's so many mentions about booster vaccines, and where you know, the government across the board is urging people to go for their boosters. This is 6 months after being receiving the second dose of their respective vaccines. But for you, you are feeling some type of way about the vaccines. Tell us more.
I mean, at first I was thinking about that if at all there would be a vaccine, it would actually guarantee my safety. But now looking at it, and they're saying if you're actually vaccinated, you can still get COVID and die from it. And if you're not vaccinated, it all lives in the same place. So I still feel like there's still health anxiety. I still feel like the risk that I need to take, because if it's not guaranteeing my safety, then I am still not decided about taking the vaccine. But I'm still working on it. I'm still giving it thought.
All right. We'll get to understand more on what's giving you, you know, the anxiety and the fact that you're like, I am not too sure this is going to protect me. But let's talk to Professor Julius as far as, you know, listening to Marceline. And I'm pretty sure this is a lot of cases for so many people in the country who are like, nah, I mean, it's not guaranteed, because we've seen people who have been vaccinated and still contracted either severe form of COVID-19 and actually died from it. So the role of a vaccine, just to make it clear.
So I think for now, we talk about the COVID-19 as a disease that is now, you know, causing havoc globally. The only tool we have to protect ourselves is the vaccination, in addition to other interventions that people have been told to adhere to.
Okay.
And so I know there are people who have concerns about if I get vaccinated, will I still be infected with this virus? Can I become sick? Yes, the vaccine, the way they were designed, they will not protect you 100% from getting the COVID infection. So you can actually get infected. But they were designed to protect you from getting severe COVID disease. So majority of people who have been vaccinated are unlikely to develop severe COVID disease and even die. And so you want to be part of this majority, right? If you are not vaccinated, believe me, if you get COVID-19, you are likely to, if you have those underlying conditions, you are likely to get severe COVID disease and you may even die. So you better get vaccinated than be in that group which is at high risk of developing severe COVID disease.
Yeah.
Yes.
But what about someone who's watching us and thinking, number one, I do not have underlying conditions. Number two, I am very young, because a lot of people say, I am very young, you know? And then number three, for those people who are like, I eat healthy, I take care of myself, I'm very cautious, you know? I wash my hands, I sanitize, mask up, social distance, like I do all those things. So I am relatively safe.
You know, that's now becoming not very true. I'm telling you that as we see these variants emerging, the variants are actually telling us that even younger people are also at risk of developing severe COVID disease. And so anybody else at this point can actually get serious COVID disease, whether you are young or old. It doesn't really matter that much. Yeah, so it's only that the risk vary. If you are older and you have these underlying conditions, your risks are much higher than a younger person. But that does not mean that a younger person can actually not develop severe COVID disease.
Yeah.
So the advice is that anybody over 18 years and above should go for vaccination, protect them from developing severe COVID disease.
All right.
Yes.
Okay. And Dr. Kwade, we hear terms like vaccine of concern or variant, not vaccine of concern, variant of concern in all those terms. So just take us through what do they mean and why it is important for people to just be cautious about some of these variants that we have in the country.
Yeah, thank you for that question. And what I will say, as a professor said, the viruses keep mutating because they need to survive, they need to continue being around. And mutations occur at very many points. Some of them may not have any impact in terms of the severity of the disease. But in some cases, they may actually lead to severe disease. Or as we have seen in Omicron, they led to more transmissibility. So whenever these variants are detected, they are monitored in terms of the characteristics that they do have. And of great importance now is how the vaccines work against these variants. And starting from the Alpha, the Delta, now the Omicron, one thing is that a number of vaccines may not be as effective as in terms of reducing the severity of the disease, but it doesn't mean they are not effective. They may just be less effective by a certain percentage point. But more important is that even that reduction in percentage point, then a bigger population continue to be protected against severe disease, and therefore the need for hospitalization, which is very costly anywhere in the world, and the potential of death. So one of the key messages is, even as these variants keep coming, I think it is important for people to purpose to be vaccinated. A variant should be reported when you are fully vaccinated. You stand a better chance. And therefore, that's why we really emphasize on the point of full vaccination.
All right, and Eunice, having reported this cases, that is of COVID-19 over and over and over again, what are people really saying out there on the ground? Because again, you interact with people, you get to hear their concerns. And like you said earlier on, people have questions, so many of them.
Well, covering COVID for 2 years now, I've met people, I've talked to people, and there are people who have vaccine apathy, Daktari. There are people who feel like those numbers, like when we're having numbers rapidly increasing, they are done so that we can have, more people vaccinated. Then I think we did not do awareness, rather in terms of educating the community and explaining more. COVID looks like an English kind of conversation because most people kule chini mashinani, the elderly, people who are susceptible to severe COVID, people who are living with other conditions, other NCDs that put them more at risk, or rather increasing their morbidity when they get COVID, they have not been fully informed about the vaccine. And that's why I feel, and I believe that's why we still have a low vaccine uptake. We look at even the second jab. Most people boycotted after they got their first one. Most people have boycotted the second one. We are talking of the third or the booster shot. And we've not explained this to people. I remember recently when I was in Taita Taveta, and there's a lady talking about another vaccine as well, but she was like, why are we having these vaccines? Why do we need 3 more again? They have not been empowered, they have not been talked through and informed the importance of the vaccines and importance of having these booster shots. Secondly, we still have, I can't call them COVIDiots per se, but we still have people who don't really believe that we have COVID. Like, it's a creation of the government. It's a creation to have a narrative going on so that we can have more of a kind of vaccine business or something, or also can have COVID kind of business. And COVID-19 has been shrouded with a lot of those corruption allegations. We still have people who do not get, the treatment they require because perhaps the facilities have not been well equipped. So to many people down there, and if you even check the data that we have, urban towns have more of people who are informed in terms of uptake of a booster shot perhaps, or even the, what do you call it, booster shot, and also even going for their second doses of the COVID vaccine. We have a county like Wajir that has recorded 0 number of people who've gone for their booster shot. So I wonder why this is so, and if the government could work hard in terms of ensuring that we are having proper public health communication. We are having more of stringent, kind of strict communication from the public health. It looks like we are being threatened, that to say the least. People feel threatened. They're being forced to take the vaccine, but the communication is really key in terms of ensuring that people take up public health communication, public health messages. And going back to, let's take it back to HIV and AIDS. When we are talking about public health awareness, it was more of fear. We are using people who are almost dying, people who are skinny, people who are frail, and there was a lot of stigma because of how the government communicated public health messages matters HIV then. And slowly by slowly, I think the messaging changed. And I hope that this is what is going to happen. Instead of using threats, or rather using, like if you do not, you'll be punished, like the repercussion. So I think the public health communication is really wanting it so that we can ensure that more and more people understand COVID-19 vaccine and where we are headed to as a country as well.
All right, and Dr. Kwale, I want you to respond to that. As far as what people are saying. And like you said earlier on, yes, awareness there are campaigns that you're planning to make sure that people really understand what COVID-19 is all about, the vaccines, and how important it is for people to take up a vaccine. But really, the numbers are still relatively low. And like Eunice said, in urban setup, that is where we see a lot of people going for their vaccines, getting even the second jab and even the booster. But when it comes to like rural settings, there's still a lot of work to be done.
Yes, thank you. We do appreciate there's a lot of work to be done, and actually we are doing that. And I want to just highlight a few things, because the issue of COVID is not only government business. The role of individual decision making is so crucial. The government will do A to Z of what it needs to do, but the person, once you've got that information, you are empowered and the vaccine has been brought to you, you also have your A to Z to do, and not keep asking questions and then remaining unvaccinated. And one of the things about apathy, which we often refer to as hesitancy, is much complex. And there are very many factors. Among them is what we call convenience. And we need to appreciate that the vaccines that are used for COVID-19 require certain cold chain characteristics. If they are compromised, you could have numbers and still have very poor quality vaccination program. And I want to qualify that. One, some of them require certain storage. They should not be exposed to sunlight. There's even regulation as to how many hours you need to transport them before they are used, and some are very short in that. So I want us to look beyond just saying we should go and start giving everywhere. If we compromise the cold chain, then we will end up vaccinating people with vaccines that may not be effective, and that is not something we can do. So here in Kenya, we've placed a lot of emphasis on the integrity of the cold chain. Now, the other thing is what you call complacency. You could educate people, you give them all the information, and they become complacent. And here in Kenya, we see whenever the positivity rate goes down, then people say, now why should I get vaccinated? And that needs to be really addressed in specific ways. You get even very well-informed people. Nowadays, you have social media, there are rumors and there are misinformation that will consistently need to be addressed. And then finally, there is the issue of confidence on the vaccines. And yes, if there is an increased number of deaths from any infectious diseases, people get shock therapy, and then they tend to turn up for vaccination. And those are lessons we learn from the HIV world. Yeah. But I think it's also important to note that when you have a pandemic where somebody exposes another one to danger, then the Public Health Act in Kenya empowers the cabinet secretary to take measures, because you could get somebody who is purposely infecting others. And therefore you cannot say this is somebody who will continue to be educated when purposely is educating. So measures must actually consider both sides of the coin, and they must protect those who may not have also the luxury, and they have taken everything they need. Okay. So whenever the measures the ministry announces, it's not a threat. Definitely it's not a threat. And a lot of these are based on experiences we've had fighting other infectious diseases in the past.
All right. But then again, there's a question of where do you draw the line between taking care and making sure that people actually comply to these measures, but also and get vaccinated, but also rights. You know, like if someone does not really want to get vaccinated, do you really have to coerce them or force them to getting the vaccine? We'll be discussing that in just a moment. But for now, we need to take a break. But we also have feedback as far as the question that we're asking you, and that is, have you been vaccinated? And if not, why? That is the question that we're asking you today. And I understand that we have a number of feedback, so let's hear what you have to say. Eunice Mugo says no and never. Period. Haya. Okay. All right. And then someone else says, this is Nyamanga Samson says, mimi hata ya kwanza tu sijapokea. All right. And then someone else says, this is Thaddeus Sakawa says, kuna booster ama mbili ni sawa, nishapata mbili. All right. We'll be answering that in just a moment. And then Tarus Evans says, no, I can't. Never. All right. And then someone else says, no, there are true myths behind the vaccine, but I am yet to get the second dose next month. Our mother can't stop reminding us on its importance. That is Geoffrey Fred, who says it is, the mother keeps on reminding them how important it is to take the vaccine. So, of course, Dr. Akwali, I'm pretty sure you can see some of this feedback, and I need you to respond to that. Same as Professor, Julius, you'll be responding to some of this feedback. But let's take that break. Keep tweeting at NTV Kenya, at Lubembe_Winnie. We'll be sampling more of your feedback. But if you need to call, you're allowed to do so. The numbers will be on your screen in just a moment. If you have a question for Professor Julius or Dr. Akwali, as well as Eunice, feel free to also give us a call. But let's take that break. See you shortly.
No, it can't be. Where the heck did Verona go?
They're leaving. I don't want to lose them.
Let's take the chance and get inside.
Please be careful.
You too, Emma. Call if you need
Yes.
something. Let's try to get a bit closer.
Wow, thank you for your time. How juicy.
Juicy. Juicy fruit.
It'll now take 36 hours to transport cargo from the port of Mombasa to Malaba. The reduced transit times now mean customers will receive their cargo much faster. You shall enjoy affordable rates from $860 for a 20-foot container.
It is safe to say we are right on track.
Akili, 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 akili. Let's chase the germs away. Let's chase the germs away by keeping our hands clean. And when you want to sneeze or when you want to
Monica bana. Unanitesa hivi. Mwanzo nikimlose Monica itakuwa noma sana.
Mzee hizo sikukusalimia. Unajua hata hatubongi mimi na wewe.
Si mtani unajifanyanga shuge.
Sawa, nimekubali. Basi hata hatujuani. Tunaongea nini?
This constant fight is beginning to take a toll on little Dasha.
Did she say anything?
No, but she is a very clever girl. She sees things, you know.
Get peace of mind and protect the ones you love with the power of Dettol Bar Soap. It cleans and protects from up to 100 illness-causing germs. So no matter what type of mum you are, trust Dettol.
What are you selling? Simply sell it on your phone. Log on to www.kk.co.ke, an online established marketplace with millions of buyers waiting. kk.co.ke. Buy anything, sell anything, fastest.
All right, welcome back. Glad you're still with us. The show is Your World, and today our focus is all about COVID-19, and we are unpacking the mystery behind COVID-19. Of course, the question that we're asking you today is, have you been vaccinated? If not, why? Have you been vaccinated? If not, why? Feel free to send us a tweet on @NTV Kenya, @Lubembe_Winnie. And like I said, we also give you a chance. If you have a question, you can call in live. The question is there on your screen. Have you been fully vaccinated? Not just vaccinated. Have you been fully vaccinated? And if not, tell us why. And like I said, you can call in. We give you that option as well to call in. If you have a question for Professor Julius Oyugi, if you have a question for Dr. Willis Akwale, or Eunice as well, who is a journalist and she has been covering COVID-19 for a while now, feel free to give us a call. The numbers are down on your screen. And of course, we'll try as much as possible and address all your questions, your concern, as well as your feedback. So again, according to a research or a new research that indicates that 46 mutations have been found, and this is in COVID-19 Omicron variant, just one variant with like 46 mutations. And of course, Alpha has 23 mutations. And remember, like we said, we also have like different other variants. So the big question is, should we be concerned as a people? And before we respond to that, we have Marceline Odhiambo, who is on Zoom. And Marceline is like, well, you know what, me, I'm not too sure if I want to get vaccinated, because she was like, there's no guarantee that this vaccine will protect me. But Marceline, I just want to understand, where is that, anxiety stemming from? Is it based on the stories that you've had, or where does that stem from?
I mean, you heard of people having complications because of vaccine. When I wouldn't say that I'm part of some anti-vaccine organization or society, I don't want to form part of any revolution, but I just feel if you can actually take care of yourself, like I was saying, everyone is at risk, I agree, but still, why are you getting this vaccination? And then with every mutation, we have boosters. There's the first dose, and then there's the second one, and then there's the boosters. I mean, I'm wondering, where does it all end? I mean, some of us are losing confidence in that vaccine, and I really don't know how the doctors are doing it, but I think everyone has a chance to actually decide if it's actually going to work for them or not. Because the doctor was talking about if you feel like you're not immunocompromised to something. But I believe that if you're not, anybody can be a risk to someone, but still we have that chance to decide for ourselves, do you want to get vaccinated? Okay, if no, then okay, all right, it's fine. Take care of yourself and others.
All right. So Marceline brings up two important questions. The one question is, number one, we do not know, first of all, where did you get these vaccines? And a lot of people are asking, it took a very short period of time to come up with the vaccine. So how safe is it? And then the second question is that aspect of then balancing between human rights and making sure that everybody is safe and that is taking the vaccine. But then again, if someone is like, me, I do not want to take these vaccines, I'll take care of myself, I'll protect myself. Why do you have to force me? Which Dr. Kwale, you'll address that. But for now, Professor Julius, listening to what Marceline, and these are very valid concerns, you know, that so many people have, including Marceline herself, you know, who's like, these vaccines, first of all, mulito haraka sana. And then number two, it's like, we do not know anything about these vaccines that guarantees that we'll be safe, you know, so just understanding the whole aspect of vaccine, why is it important, and why do we need booster shots?
Okay, that's a good question. So number one, where did this vaccine come from? And why did it take such a short time to develop vaccines? Number one, you know, we have been having outbreak of diseases globally before. I remember in 2014, there was Ebola outbreak in West Africa. And during outbreaks that lead to deaths of a number of people, scientists normally come together to start developing tools, either in form of vaccine or in form of treatment. So these tools, once they are developed, they act as a bank. Next time there's a pandemic, they look at the tools that are already existing and whether they can use them to develop vaccines. Okay. So the vaccine that we are using today is using what we call mRNA technology. This technology was not developed during COVID, when COVID came. It had been developed before, but now when COVID came is when now they actually experimented to see if it works. And it actually worked. That is number one. So the mRNA itself is very safe. When it gets into your body, it will make parts of COVID virus, which is not the entire virus, only the parts of the virus that only train your body to produce protection, right? And then it dies. So there's no risk at all of, you know, mRNA vaccines. That's number one. Number two, how did we develop this vaccine so fast? So I've told you that we developed technology and we bank them, right? So already the technology was already there. That is one. But again, if you look at the global, as we speak now, we are developing technologically. Previously, and you heard this a lot in 2020, when people were developing vaccines, people were saying that the minimum number of, you know, time that you need to develop vaccine is 1 year. But that was before. Now we have the ability to develop a vaccine and test it within less than 1 year. Right. And this was done. And for a vaccine to be used in human beings, by the way, it has to go through very rigorous testing in humans. Number one, to look for how safe is this vaccine in humans. That is very key. So a vaccine cannot be approved for use in humans unless it is safe. It has been established that it is safe for humans. The second thing they look for is this vaccine going to provide you with the protection required against the disease that is now circulating? That is number two. Now, if those two things have been approved through a thorough study, then the vaccine is approved. And there's one body that approves vaccine globally. The current vaccines that we are using were initially given emergency approval because of pandemic. But they've actually shown that these vaccines, once you are vaccinated, although they may not protect you from getting infection, but they protect you from getting serious COVID disease.
Okay.
So I think the viewers should be, you know, number one, they should remove the notion that the vaccine are not safe. There is no evidence whatsoever that has shown that majority of people who have been vaccinated have died due to vaccination. When you go for vaccination, by the way, you may feel pain, you know, you may feel body weaknesses, but we call them vaccine reaction, which actually disappear within less than a day. After that, you are okay and you are protected for some period of time. So I think our viewers should not be, you know, should not stick to this myth that vaccines are not safe. I can't go vaccine because they were developed within a short time. Me, as a virologist, I've been vaccinated, right? So if I know how vaccines are made, I know whether the risk about vaccine and have been vaccinated. How about you, right, as a viewer? So I would encourage our viewer to go and get vaccinated. The third thing, and as I said earlier, when new variants come, now you see like Omicron, we are talking of a booster, right? But if you look globally, when Omicron came, the number of people who were ending up in the hospitals were the unvaccinated.
Yeah.
Majority of them were the unvaccinated.
People who've been vaccinated.
Yes.
Okay.
So do you want to be in that group of people, when a new variant comes, you want to end up in the hospital or die? I would rather be vaccinated. Now, if a new variant comes, I will be partially protected against that new variant.
Yeah, but now the question is, how many boosters do we need to make sure that we are protected? I mean, will it get to a point? There's a meme that is on Twitter. I think we'll have it up in a moment, where this person said by 2030, fully vaccinated, you have like jabs all over, you know, all over until your forehead. So the question is, how many boosters do we need? And you'll answer that in just a moment, Professor Julius. But let's talk to Dr. Kwale. You know, where again, what Marceline is saying. Listen, I do not want this vaccine, and I think it's a stand for so many people who probably have been categorized as people who are hesitant to getting the vaccine or anti-vaxxers. But then again, where is the problem? If someone says, listen, I do not want to get vaccinated, yes, I'll observe all these protocols. I'll make sure that I am safe. If I do not want to be vaccinated, why do you have to coerce me to get vaccinated? I think we've had this measure by the Ministry of Health that some of these people have been locked out from malls, from accessing public offices. Again, isn't this like, you know, an infringement of a person's right? Because like Health Ministry said, and this is through the CS, that listen, this is voluntary, okay? We are not forcing anyone to get vaccinated, but at the same time, it's like we're forcing you to get vaccinated.
Okay. Yeah, thank you for that question. And what I would want to start by saying is that, you know, we need to know that the coronavirus is a new virus. It's a global pandemic, and there's still a lot to learn from it. And we need to appreciate that it is at the point where we may drop our guard, is at the point we may feel like these things are not working, that we may be hit hard. We need to learn from the Spanish flu. When the second wave came, that's when most people died and they had dropped the guard. And we saw something in India last year when people was just complacent, and this is very fresh, less than a year ago. So one of the things we need, I want to reiterate here that COVID-19 vaccination remains voluntary in this country. And what we are doing as government is to ensure that we give information so that people are vaccinated for first their own benefit. But it's also important to realize the government has to put in regulations to protect others. When you talk about human rights, a line needs to be drawn because there will be groups that need protection. You see, Winnie, like if we came to this studio and yes, Prof has said is fully vaccinated and boosted, even you will feel comfortable in this enclosed environment among people fully vaccinated, because science has also shown us that the vaccinated people shed fewer viruses than the unvaccinated. I believe you'll be very uncomfortable to have 6 panelists here with no vaccination at all. You'll be at risk yourself. So then the public health measures start coming in, and this is to ensure that the rights of both those who don't want to be vaccinated and those who are fully complied, we start getting a balance to protect each other. And then secondly also, there's something on the issue of herd immunity or population protection, in which you see the more people that are vaccinated, the less the transmission of an infectious pathogen within the community. So, you know, we have the up to 15-year-old who are not getting vaccinated, but we need to protect them. So it requires then we have as many people so that we protect those under 15. So what is the right of those 0 to 15 years, the newborns, who may be, whom we know can be protected by reducing transmission at community level? So mine is to really say, yes, you may have your right, but you must also consider the others also have their rights. And where government comes in is to be in the middle and ensure regulations protect both.
All right, and talking about regulations, I mean, there's some people who will be like, and I'm pretty sure, Eunice, you've encountered these people who are like, fine, number one, I do not want to get vaccinated, but it doesn't mean I expose myself, right? It doesn't mean that I'm just out here walking around with no mask, walking around, you know, not sanitized, not observing all these measures. I am observing these measures. I am masking up when I'm in a public place, but at the same time, I have my concerns. I mean, others who are like, for religious purposes, I do not want to be vaccinated. So in terms of then, fine, and we understand that you also have to look at the public interest in terms of protecting all these people, especially the big, you know, population of people who have been vaccinated. But then again, also those ones who do not want to get vaccinated. Eunice, what do you have to say to that? Because again, you know, Dr. Akwadle, together with the entire ministry, is like, we have to protect people at all costs. But then again, who then protects this other group of people who are like, I do not want to get vaccinated?
Thank you, Winnie. And before I answer your question, well, these are concerns. I feel like the Ministry of Health is shifting the blame to, or rather the responsibility to the people. Like it is your job to protect other people. And then again, I also feel like there's a notion of, top to down kind of business with the vaccines, you know. I would like to understand from Daktari, what is the government doing? What is the government doing to ensure that at least we are having the community involved in all this, you know? Instead of, as much as we have the public health, which I, as a health journalist, really know it is very important, but how do you communicate with the other half that says, I do not want to be vaccinated? Then still on it, I'd also like Daktari to explain to us, because he's talked about the more people are vaccinated, the more we are protecting the community. The other aspect, the other argument I'll ask, how about the more people are infected, the more we have a natural immunity after the infection. And I still look at how the government moved with the chain of command, or rather chain of management, matters HIV. And we are now doing HIV programs, you know, involving the community. We are having them form their own decisions because they are a group from the ground. But we are having even countries, you know, let's give an example of Kenya. We have women, you know, living with HIV, and they have their own community, and they can inform the rest because they've been enlightened. I still feel like the Ministry of Health is not really involving the people in this, but the people are being blamed why they're not taking the vaccines. We have countries that are doing door-to-door vaccination, you know, vaccinating their people against COVID-19. Daktari talked about the cold chain. How is it a Kenyan problem who is at home and being told to go to, you know, leave my job? Well, some of them are business women. They have to leave their businesses to go and get vaccinated at a facility. Why can't the government make this vaccination easier for them? Why should I go and line up, maybe in Bagathi or Kenyatta National Hospital? Why can't you bring this vaccination to me like they do with polio vaccine? And then I'd also like to hear from the government. We have a lot of vaccines, you know. We have a lot of vaccines. Since we started receiving these vaccines on 3rd March, that midnight, I was at the airport. Do we have vaccines that have expired? Have we had cases of you know, expired vaccines? Because I remember last year before WHO Africa, they closed for the season. They mentioned that 9 million vaccines in total had expired in Africa. So do we have such situation in Kenya? And how are we protecting the people? Matters, if at all, the government will respond if we have the expired vaccines. How are we protecting people against such? But I really want to know, why can't we take these vaccines to the people? Why do we have to string people to go to the facility? So that at least it can be easier. Let's meet 50-50, meet me halfway. Make it easier for me. You want me to be vaccinated, make it easier for me.
Yeah,
like you do with polio.
Yeah, because, I mean, Dr. Akwale talked about an aspect of balancing. Yes, get vaccinated, but also at the same time, making sure that you do not put other people at risk of the same. So, Dr. Akwale.
Okay. Thank you. I think there are important issues there that I need to talk to. And the first one is the issue of access. And Eunice will agree with me. Last year, you saw us at bus terminals. You've seen us in churches. You've seen us targeting the elderly. In fact, go and look at the data for Kakamega County, where they really employed access to the population. And you've seen the increase in that. In the uptake, and now Kakamega actually is the 4th best vaccinated from 23 within a month.
Nice.
But you realize every county has different. The same measures were employed elsewhere, and you may have other factors coming in. And I also really want to say, remember, polio is oral. These are injectable. One of the things people should know, infectious prevention control as part of COVID-19 is a very key element. Remember, you are using syringes and needles, and the blood from that could start spreading infections within community.
Sure.
So these are factors that one has to take into consideration. And then, as I've said, the carrier boxes, the cold chain that you have to do the outreaches with is also a very important thing to ensure that that is maintained. I know the countries where you are hearing high population, they have different characteristics. Mauritius, Seychelles, almost 100%. These are small geographies that can. And you can see even here in Kenya, like Kipia is doing very well, small areas. But we ensure we address this. We are not saying that one measure is what we are concentrating on. We are going with all those measures. Now, you raised the issue of natural infection, and that is an important one. If natural infection was conferring a lot of immunity to people, then the people in the Northern Hemisphere, America, Europe, would actually have already got all that protection. Yet now, as we know, that is where the burden is highest. Yeah. And right from the beginning of this pandemic, it was discovered that 3 to 4 months after the first infection, people are getting infected again. That was a very clear indication that natural immunity is not fully protective. And then I have always said there is what you call an ethical question. Because we know the case fatality rate of this infection could be anywhere between 3 to 6%, meaning out of 100 people, maybe 5 will die. So if we tell people, wait until you're infected, who are those 5 who are supposed to die? Is it me or you, Eunice? So again, but what we know, vaccination immunity, first, it has given a 6 months protection. Then there's evidence of it waning. And the best evidence came from Israel late last year, where the number of people who had breakthrough infection and had to be admitted, 90% had not received their booster doses. And that's why now we are really emphasizing on the need of a booster dose. That evidence is basically there. Then I think one of the things, and this is really my final point at this, we are not saying government is pushing people to do, but public health, actually you have to work through people. And you get different experiences. HIV/AIDS is a chronic disease. We are now dealing with a highly infectious global pandemic whose responses must really be constant across the globe. Because if there is fire in America, we are not safe. Tourists will be here the next day. We are a tourist destination. People will be coming here for business, and we are on fire the next day. So there are differences between what a lot of us had used to for many years in public health, chronic. There are lessons to learn there, but we also have lessons that we are learning with a highly infectious disease and measures that need to be put in place. Thank you.
All right, and there's a lot of concern about the herd immunity, and like Eunice rightly put, I mean, why not, all right? But of course, there's a lot of controversy surrounding the same. But Dr. Akwali, I think probably you'll answer this after Professor Julius, about the aspect of, fine, we are encouraging people to go for their booster shots. But then again, there's some counties where the level of vaccination is still relatively low. I mean, according to the graphics that Eunice prepared for us, which I think we'll have on the screen, and Eunice will take us through some of this, especially some of the counties that are least vaccinated as compared to, the others. There we go. Eunice, you want to take us through that very quickly?
Okay, back to the vaccines and the Cairns vaccination campaign. So we have, as I mentioned earlier, the urban towns, or rather urban counties, show a high percentage in terms of the vaccination uptake. Nairobi leading at 1.1 million, that is 37.9%. Then we have Nyeri at 180,246 people who've been, vaccinated. Then you have Laikipia at 88,265, that is 28.8%. It's safe to say in Laikipia, at least 3 out of 10 people have been vaccinated. Kakamega, as Dr. Akwali had mentioned earlier, I think the drive that they had, involving the community, gave it a boost. So we have around 255,138 people who've been vaccinated. Then in Kiambu, we have 419,490 people. This is safe to say, Daktari, in Kiambu, at least 1 out of 4 people have been vaccinated in Kiambu County. Then we have counties that have, performed poorly in terms of vaccination uptake. We have Marsabit, for only 14,000 people. That's around 6.6%. We have Mandera. We have Turkana, which has 24,428. Then Wajir, which has 17,263. Tana River, 6,874. And I'd like perhaps Dr. Kwale will explain to us what measures are they making to ensure that they're put in place to ensure that these counties, the northeastern part of the country, are reached and they're not secluded. Because as much as we're talking about the Public Health Act, then let us look at the Constitution. Everybody has a right to proper health care. So these people, I feel there's more that needs to be done to ensure that they are fully vaccinated in order to achieve the herd immunity that Dr. Adi was talking about.
Yeah. And of course, we'll also look at the booster shots, which I think Dr. Kwale is really, really emphasizing on, as far as the booster shots. And there we go on the screen.
Yeah, we have the highest counties, with the counties with the highest number of people who've shown up for the booster shot. Well, we are still doing low because we are about at total of 100,000 people who've shown up for their booster shots. And well, Nairobi leading, I think, because of the proximity to these vaccination centers. And then there's also the issue of the number of vaccination centers that we have in a county. Nairobi has a high number of them. So we have 54,000 people, 862, who've shown up for the booster shots. Nakuru at 8,213, Uasin Gishu at 5,747. We have Kiambu, 5,576, and we have Mombasa, 4,991. And basically, still, if you look at the counties that have registered this high number of people who've gone for their booster shots, it resonates also with the number of people who've been fully vaccinated. And most of them are these urban counties. So I think we still have more to do. Then we have counties with the lowest number of booster shots. Garissa at 33, Tana River at 22, Lamu at 12, Mandera 9, and Wajir 0. And the same concern in regards to, I think the Ministry of Health needs to highlight and explain to us why are we talking about a herd immunity and we still have counties that have not had booster shots? Is it that we do not have enough vaccines, which I know are there, or is it that we are not doing more campaign? We have a lot of vaccines, 24 million vaccines. I'd really like to understand.
I'll explain.
Yes, I'd really like to understand how are we going to help my sister in Wajir get vaccinated?
I totally will explain.
Yes.
Thank you.
All right. Okay, Dr. Kwale, before you respond, I do not want to lose Marceline. And Marceline, again, listening to what Dr. Kwale is saying, and also Professor Julius, as far as it is important for you to get vaccinated, yes, we understand that you might have the aspect of I do not want to get vaccinated, but remember, again, Public Health Act. So for you, listening to what Dr. Kwale is saying, how do you respond to this? And because there's some people who are like, listen, I can't do this because, again, I do not really want to get vaccinated. But you listening to what Dr. Kwale is saying, what do you have to say as far as sometimes it is important for the government to push people into getting vaccinated to protect the larger population? Marceline? All right. So as we sort out Marceline's connection with us, let's take a very short break. But of course, we also want to focus on your feedback as well as far as the question that we're asking you today. And that is, have you been fully, not partially, have you been fully vaccinated? And if not, tell us why. We'll be looking at your feedback. And of course, Dr. Kwale will also be responding to that aspect of then why is it some counties are experiencing very low uptake as far as vaccination is concerned, and others, especially the urban areas, you do not want to miss that part of the conversation. Stay with us. See you shortly.
Subscribe to Classic Bouquet on aerial decoder for 899 shillings or Smart Bouquet on satellite for only 999 shillings, or you can watch on the Star Times On app. Star Times, home of the Africa Cup of Nations 2021.
Why do we do it? Hide, cover up, tone down. Choose boldness. Celebrate the skin you're in and dress with confidence with Nivea Nourishing Cocoa Body Lotion. The triple layered care of deep moisture serum, precious cocoa butter and vitamin E enriches your skin for 48 hours. It's time to show off your best skin. Wear your skin with pride every time with Nivea Nourishing Cocoa Body Lotion.
Molfix, let's see what they're developing right now.
Molfix pants with anatomic fit technology. New Molfix pants, an invention from babies for babies.
You should also try Molfix.
CASNEP has launched the following vocational qualifications in entrepreneurship and innovation, graphic design, information and cybersecurity, blockchain technology. Enroll with a KCSE certificate. Visit our website www.casnep.or.ke to access the student portal for registration and examination booking.
The First Lady.
What did you say your name was? Christina. Nice to meet you. Paloma. Bye. Bye.
Paloma, come here. What's wrong with you? What were you doing talking to Santander's daughter?
Oh, cousin, I'm just getting to know people. But listen, don't worry about anything. If everything turns out the way I'm planning, you'll get rid of me very soon. Bye.
What do you mean? What do you mean, Paloma?
The First Lady.
Patroba chunya dwaro nibede mama watoto salimie morning nyarabando chunya gombo nibede mama watoto ani chunya gombo nibede mama watoto mama chunya gombo nibede. Habari wa Kenya, naitwa Prince Inda. Kupata wimbo wangu bonyeza *811*928#. Skiza na Nation, supporting local talents.
It's the headquarters of good vibes. So I should just kneel and begin to call on Jesus because I'm a bishop.
You know, Dr. Kingori, yes, you sound like a street fighter. Where did you grab it? Unataka noma.
Kingori, let me tell you something. Mimi mtu angenipata saa hiyo nikiwa first year, angeangukia bibi mzuri.
You know, they always say smart women, where to catch them is with love.
Kingori, I love how your suit looks. I love you in a suit. I love you in a t-shirt.
As in any example, you actually mean that.
Maifungua akili ya msee ama kichwa ya msee ukapata vile watu husema jamaa ana akili.
Tunaweza toa nyama kwa huko nyuma tuweke kwa
kifua. Sisi mtu anakuwa na roho chafu sana. Na ukidive inahesabiwa?
Si ndio, ukiwin, udive win, si umewin.
Hiyo ndio tizi unafaa upige. Napiganga tu tizi ya 90 meters ya kwanza, alafu nikifika 90 meters na fly. Every Friday on NTV 7:30 p.m.
It is difficult to know where to start when dissecting the current United. From top to bottom, a shadow of the Sir Alex Ferguson era. But one area to start when considering United's fragile facade is Cristiano Ronaldo and Paul Pogba. Now in his 10th season at Tottenham, Lloris has made 395 appearances for the club, established as one of the best goalkeepers in Spurs history. All the news and analysis of European football on The Football Review.
What are you selling? Simply sell it on your phone. Log on to www.kk.co.ke, an online established marketplace with millions of buyers waiting. kk.co.ke. Buy anything, sell anything, fastest.
All right, very fiery discussion that we're having over there. And of course, you just said Dr. Akwale in Studio V, right? And I do not want to lose Dr. Akwale. So can you just briefly respond to all these concerns? And also, given the feedback that we read earlier on, where everybody's like, absolutely not, no, thank you very much. And Marceline is, you know, again, raising very valid points. And also, someone is actually asking me, so will the government arrest everyone who's not vaccinated?
Does the government? No. Okay. Now, thank you very much for that. And let me mention first two things. Starting with the booster shots, you've seen the numbers and you see that the counties, urban counties are doing very well, and the arid and semi-arid counties are not doing very well. And let me remind Kenyans, when we began our vaccination program last year, we began by prioritizing frontline health workers, majority of whom were healthcare workers, security forces, and teachers. And what you are now seeing, the booster shots, are the people who were fully vaccinated by 30th June, because you have to finish 6 months. So what you are seeing there is not necessarily population. It is based on the number of healthcare workers who are the main drivers of vaccines at that time. It is at the end of March that His Excellency took his vaccination, and then we opened to the general population. Now, next month you may see now the 58-year-old taking up more of the booster shots. So what you have seen is actually a reflection of how many healthcare workers. And during that time, we observed a county like Kajiado, immediately we opened the 58, it became very high numbers because a lot of people have settled in Kajiado, but they don't have as many big facilities as Nairobi, Nakuru, or Kisumu. Okay, having said that, now the second thing, and this comes to the issue of expiries. As we speak now, there have been no on-shelf expiries of vaccines in Kenya. And when they will occur, if, then that will be known, because we have to account to the people donating to us. We'll tell them the vaccines expired. We'll not have to show them. We have to show them where they reached. And you must then realize the reason, two things have worked in our favor. Strategically, we adopted Johnson & Johnson, which we send to most of the hard-to-reach areas where the uptake is slow. The shelf life of Johnson & Johnson, when stored under refrigeration, is 2 years. And if you look at how many stocks of Johnsons we have, you will find they are the majority of vaccines that we do have. Now, I know the issue of AstraZeneca. That is the one that keeps us working very hard to ensure that any doses that are near expiries are used where the demand is there. We go beyond our call and even fly vaccines across counties to ensure that there are no vaccination. But there's something known as wastages. And for example, when you open AstraZeneca, after 7 hours, you have to discard it. You can't use it. Wastages do occur. But at the same time, within a vial, you could get 1 or 2 extra doses and you vaccinate more people. And every month we look at the wastages against the gains. And the last that I looked at last December, we had 3% efficiency, meaning that out of 100 doses we administer, we actually vaccinate 3 more people. Now, coming to the question, do we know who is not vaccinated? The only way we want to know that is by giving you a certificate. That's why we developed the Chanjo system, so you can be asked if show proof of vaccination. It is basically through that vaccination. Otherwise, in terms of data protection, we are not going to go and say you by name, you are not vaccinated.
But Dr. Kwale, why are we talking about booster shots, and yet from the statistics that we received, only 5 million people in the country are fully vaccinated? Like, why are we talking about boosters to these people who have who are fully vaccinated, and yet there are some counties where there are some people who have not received even the first dose, you know, of a vaccine?
Okay. Now, let me, in terms of doses, from where we sit, you saw 1 million. In fact, let me assure Kenyans that in terms of the number of doses that we need to both have booster doses, remember booster doses are very important to protect the people who are affected and likely to die from the disease. The frontline health workers, if there's going to be a pandemic, we could lose, and then the healthcare system is overrun. We have enough doses for both full vaccination, and Eunice asked me offline here, are we going to achieve the 19 million? If you look at our statistics, see that 6 million people are partially vaccinated. Immediately they take their second dose, they'll be fully vaccinated to add to the 5, and that will be 11 million. Then the other thing you need to know, Johnson & Johnson, 1 shot is full vaccination.
But I think we still have a problem. We still have an issue of people who have not gone for their second dose. I remember last time you were hunting for people who have absconded the second dose. Do you think
about 100,000 of them?
Yes, 100,000 people who had absconded. So do you think you're going to make to 19 million in June to ensure that these people who got their first dose get their second dose?
Without coercion.
Yeah, without coercion.
By the way, that situation changed, and I'll explain. And I wish I came with a graph to show you.
Okay.
That situation occurred in especially August and early September. And the reason was that's the time we were getting our first Johnson & Johnson, Moderna, Pfizer was coming. So people who had taken the others were now waiting and saying, I want to change the vaccine. Currently, the uptake of the second dose is actually not a worry. People are coming for second doses because now people have settled on the vaccines. In fact, it's very interesting that demand for AstraZeneca is actually high. There are now those who have said, I'm AstraZeneca. There are those who have said this. So that was a temporary, and I have a graph that can actually show the uptake. That's not a very big issue for us now.
I'd like to know people who are interested in Sinopharm vaccine.
Okay. All right, let's come back to this. And you know, we're talking about booster here, booster there, booster shots, booster here. And earlier on, I asked Professor Julius Oyugi, will it ever get to a point where we'll need a booster on top of a booster, right, to get vaccinated? Because like I said, there's that meme of someone who's like, by the time it's like 2030, hiya, my forehead, everywhere else, you know, all full of needles because of the vaccination. So just talking about booster shots, why it's important, and will it get to that point of a booster on top of a booster shot?
Yeah, thank you very much. So I want to say 2 things about booster vaccination. Number one, the current vaccines that we are using, when they were developed, you remember earlier on we said they were developed within a short time. So we didn't gather enough data to know how long the protection will last. So that was one thing. So that data is being gathered as we move on. So what is coming out is that there's a possibility that the protection that this vaccine offer, they wane with the time. They go down with time. And for you to be fully protected against the circulating, COVID-19 virus, whether it is a new variant or the one that is already existing, you need to have your immunity at a certain level. And that is the reason why booster vaccination has been implemented. Most people say that booster is because of the Omicron. Omicron is just coming because most people have now gone past 6 months. Most of the vaccines were estimated that the immunity will last, will start going down after 6 months. So that is the reason why we are giving people boosters. That's number one. Number two, we have had a few variants of COVID now circulating in the population. And the viewer was asking, by 2030, will he have, 30 or 100 boosters?
Boosters, yes.
Yeah. So what we know for sure for now is that even the emerging variants of COVID-19, the vaccines that we have now are fairly good in protecting people from getting serious disease. So we have not seen a situation where a variant has emerged and our vaccines are completely useless in protecting people. So the protection that they provide is very broad. It's unlike other vaccines which only target one aspect of the virus for protection only. So it is important that viewers understand that the boosters, well, so if we talk about the immunity lasting for 6 months with the previous vaccines, we are also going to gather data. If you get a booster, how long will you stay protected, right? Is it going to be 6 months, 1 year, 2 years, right? So depending on how long you will maintain immunity with the booster, that is what will determine how many boosters you are likely to get.
Yeah.
But finally, I just want to remind the viewers that there's a virus, influenza, which I think most viewers may probably know, that every single year we make new vaccine because of the emergence of a new variant every year. And people who are at risk of getting severe disease due to influenza are given vaccine, which is made on annual basis. Only people who are at risk, right?
All right.
Yeah.
But did you think this aspect of then monitor for 6 months, especially after you received your booster, just to see how your immunity is doing and then maybe add on to another one? Don't you think this is one of the reasons why people like, for instance, Marceline, who's still with us, I mean, is like, there's no point, because if this thing is not giving me the protection that I need, I mean, why do I need to go, I mean, and get booster after booster after booster, and yet I want an assurance that this thing will protect me? Let's hear from Marceline,
can
and
I
then we'll come
can
back
I say
to
something before that?
Okay, very quickly.
So if you look at the goal of vaccination now, there are two goals. One is to protect people from getting severe disease. But two, most countries are actually moving towards vaccinating a critical number of the population, whereby you will get herd immunity, meaning that once everybody gets herd immunity, it will be difficult for this virus to circulate in the population, and there will be no need of vaccinating people because there will be less new transmission.
Yeah.
Yes.
All right, and Marceline, I'm listening towards Professor Julius is saying again. What is this? Does this concern you more?
I mean, he's talking about herd immunity, and I'm like, is there a point where we'll reach when everyone, I mean, everyone in the country is going to be vaccinated? But I'm still thinking about, like, I've heard there's a group who are like, I really don't want to get vaccinated at all. I'm actually not with them. I just feel undecided. Because if I'm still at risk of contracting this disease, I mean, this virus, then I'm like, why do I need to take the vaccine if I'm not confident about it? Because I'm like, where does it actually stop? There's now take 1, take 2, then boosters, and then it mutates, and then, I mean, the way it goes and mutation goes on, then new boosters and new vaccines are coming up. I mean, let me hope there's going to be just one big dose for this killer thing, and then we're done with it.
All right. Professor Julius, what do you have to say? Like, can we just get one, you know, instead of all this, you know, vaccines and boosters and all those things?
So again, as Dr. Akwali had said earlier, this disease is new. We are getting new variants emerging every time, and we don't know whether Omicron is the last, and it may not be the last variant, right?
True.
So we may actually end up with a new variant which behaves differently. Either, you know, it is resistant to the vaccines, or it kills people, you know, very fast. We don't know. And the only protection that we may have if that new variant comes, and we are seeing this with these emerging variants, that those who are already vaccinated, even if a new variant emerges, then you are better protected than someone who is not vaccinated. So I think the message should be, get vaccinated and protect yourself. If we are able to vaccinate enough number of people and we achieve that, you know, herd immunity target to build herd immunity, there will be no need of vaccinating people because very few people will be infected.
Yeah.
Yeah.
All right, but still a lot of people say, but there's some people who I know who have died after getting vaccinated, not just one, but two. You know, getting 2 doses of the vaccine. So then where does the guarantee come from? But I want to hear from Dr. Akwali because, again, just recently we had LCS, that is Mutating. We're talking about the Kenya Biovax Limited. This is a vaccine manufacturing plant to be installed in the country. So the big question is then, how soon should we expect this plant to be operational? Because the president last year said these need to be operational by Easter.
Yeah, thank you. And indeed, we are on course for that. Following the gazettement of the Board of Directors of the Kenya Biovacs, there has been recruitment of staff and it's still ongoing. A facility at Kenya Medical Supplies Agency in Embakasi warehouses has been identified. It has been evacuated for refurbishment. And what you need to know that the most important aspect of vaccine manufacturing are two, the equipment, and number two, the active pharmaceutical ingredient. So what I know is that the Kenya Biovacs Limited is in discussion across the world to identify the partner that they will then get in touch with, starting with what we call fill and finish, which is basically getting the bulk of the vaccine material and packaging it here locally so that we start. That is really going to be the first stage. But the spectrum of Kenya Biovacs is to go into full human vaccine manufacturing. And let me say, if you look at the media advertisements last week, you will see that already an advertisement seeking those partnerships was sent out. So it is on course. Staff have been identified, and it's a busy period for that team, I do know. We offered the technical advice, and they have taken off very well. Now, let me say about people who have died following vaccination. We have a National Vaccine Safety Advisory Committee. And what I can assure you, we have had serious events, but there has been no direct death from a vaccination. However, what the committee has informed us, there are very many people who decide to get vaccinated once they have got the COVID virus, the disease. So many of the deaths will be from the disease itself, not the vaccine. And it is something we really need to also inform Kenyans. A vaccine protects you, and it typically takes 2 weeks to offer you protection. So don't wait at the point when you have now the COVID disease, and now you say, now is when I'm going for a vaccine. That's not a treatment. So, and really that is where a lot of people who are reporting complication, and when it is followed, it's actually more of the disease and not the vaccine. Thank you.
All right. So then what does this mean for Kenyans as far as, you know, the manufacturing plant? Does it mean that then we'll have enough vaccines? Because like we said, we have enough vaccines in the country, but yet there's some counties that are still experiencing low numbers, you know, of COVID-19 vaccine uptake. And like the health CS talked about, it's not only for COVID, but also, you know, other illnesses. So really, what does this really mean for Kenya? And will this at some point or in one way or the other help change the minds of people who are like, maybe vaccines, absolutely not, because it's not only COVID-19 vaccine that we hear people say no thanks. There are other types of vaccines that people are resisting as well.
Okay, thank you very much. What it basically means, one lesson we've learned from COVID is that you could have the money. And actually, I was here not long ago in June when Kenya had the money, but they could not buy the vaccine. It was not available globally. It's not a situation a country wants to find itself at all. And the same thing happened with the PPEs and others at the beginning of the pandemic. So for me, first and foremost, it's an extremely important strategic direction we've taken. We will be better prepared for future pandemics. We will be better prepared for the long haul, if need be, of this COVID-19 pandemic. But more important is also to link our academic and research institutions, the work they are doing, to now also translate them into local solutions. We want also to be the first ones to make certain of the vaccines. And diseases keep changing, and really vaccination has been shown to really save and even eliminate disease. People may not have been born when smallpox was causing havoc. If you look at the pictures, it is vaccination that ended it. And therefore, even for this COVID, really for us to move from pandemic, endemic to a level of control, we'll need vaccine. And therefore, it is strategic that Kenya produces these vaccines locally and many other biologics that can be used for disease prevention.
All right. And Eunice, we need to end the show. I know you still have a lot of questions for Dr. Kwale. And especially with the new, with this new vaccine manufacturing plant. But really, what do you have to say in the briefest of briefs?
I still feel like we are putting the cart before the horse, because yes, you're having that vaccine producing plant. How much are we investing in research as a country? The budget is really wanting. we are not funding our research institute that is supposed to be. So when we are saying that we want these researchers to work in this vaccine plant, vaccine processing plant, are we looking at research in terms of diseases, you know? Are we projecting how we are going to handle COVID, not only using the vaccine, but how are other ways that the medical field or other researchers are being supported by the government to ensure that I feel that we're just focusing on this vaccine processing plant and we're not focusing on the research that might go beyond just COVID-19 and other pandemics. Then I'd also like to ask Daktari, we've had people get fake certificate. You know, as much as you're saying everybody should be vaccinated, we have people getting the certificate from Mchanjo. And the change system. What is the government doing? As in, it's like you're filling a bucket with holes. Get vaccinated, but still, I will collect somebody else's certificate and have not been vaccinated. So, what are the measures that the government has put in place to ensure that at least those loopholes are not, are sorted?
Dr. Akwale, can you answer that in like 30 seconds?
Yeah, and I'll answer the two questions. One, the very first one about the issue of research. In fact, what we've discovered that a lot of our research, without an entity like Kenya Biovax, a lot of our innovation has been stolen and packaged abroad. In fact, for Kenya Biovax, KEMRI is going to be the one doing research and development, while Kenya Biovax will do the commercialization. And very soon, a very important innovation that we've done will be announced in this country and done in a record period of time.
All right.
Now, when it comes to fake certificate, let me tell you that criminal elements will be there anytime. And for us, those who have actually attempted, it's now a matter under investigations. And I'm sure in the next few weeks, you may hear people arraigned in court.
All right. And we'll hold you accountable to that, Dr. Akwale. But Marceline, so after the whole conversation, listening to Dr. Willis and Professor Julius, do you feel convinced enough to go get vaccinated, or you still hold your stand that not too sure? Very briefly.
I think I'll get in touch with Dr. Willis or Julius or Eunice and weigh my option. Huh?
She still needs a lot of convincing. And Dr. Akwale, I'm pretty sure you're picking up this because this is probably the situation with so many people that I need more convincing for me to really make a decision whether I want to get vaccinated or not. So I think it's a lot of work for you, Dr. Akwale, and the entire health ministry to ensure that Akina Marceline gets vaccinated. But Professor Julius, again, just to wind this conversation up as far as the mutations, the vaccines and what they're supposed to do, and also talking about the booster shots, and just to tie everything up, what would you say?
Yeah, so to the viewers, there will be new variants of COVID-19 as long as the virus is still circulating in human populations. So we need to work hard to vaccinate people and achieve the herd immunity target so that we reduce that transmission.
All right.
And finally, I just want to add something in relation to the newly developed vaccine facility.
Okay. All right.
And this is to Dr. Akwale.
Yes.
That Kenya Medical Research Institute is not the only, are not the only researchers in this country. University, where I work, has a lot of people who are doing research in infectious diseases.
All right. You might
and
want
so
to have a
probably
conversation.
they need to also include us in this venture.
All right. He's here. You'll have a conversation with Dr. Akwale after this. So we have to end the show right now. I know we're going to continue with the discussion, but hey, time is not on our side. So thank you very much to all of you for sticking around till the end of the show. And of course, to my able panel, thank you very much as well for driving the conversation. So we have to end it here. My name is Winnie Lubembe. Have a lovely day ahead. But tomorrow, we'll still have an amazing conversation you do not want to miss. But until then, stay safe and God bless.